The Partnership for Health Medication Adherence approach has 7 steps for conducting a brief adherence counseling conversation with patients at every clinic visit. In this video, you will see a counseling conversation between Dr. Morales and her patient Kevin during Kevin's 3-month checkup at his local health clinic. Dr. Morales starts the counseling conversation with step 1, establishing trust and communication while asking Kevin about his medication adherence.
Well, Kevin, your numbers are looking good. Your viral load is down, and your CD4 count is up since your last round of labs.
Cool. That's great.
Let's check in about your medication. How's it going taking your medication every day at the same time?
Well, I try to take it every day.
Great, I'm glad to hear that. Any side effects since your last appointment?
No, I don't think so. I feel fine.
Okay, that's good. I know you were working on a plan to take your pill every day, and that's not always easy. How many pills do you think you've missed since your last appointment?
I think maybe I've missed a pill or 2 a week.
What happened last week when you missed taking your meds?
I don't know. I guess I just forgot.
Okay, let's talk about that a bit more. When do you usually take your medication?
I usually take it when I eat dinner.
What was happening the last time you missed taking your pill at dinner?
I was going into work and I had dinner on the way. I used to work days, but we're short-staffed lately, so I've been working some evening shifts too. It's really hard to keep track of the hours, actually.
That sounds challenging, especially since taking a pill every day is a new routine for you.
Step 2 is to emphasize the importance of adherence.
So let me see if I understand you. You said you were close to being completely adherent to your evening medication schedule, but lately your work schedule has been less predictable and you've missed a few pills in the past month. Is that correct?
Yeah, that's right.
Okay, thanks for confirming. Let's talk about some ways to support being able to take your medication all of the time.
I mean, maybe I miss some pills each month, but since I'm doing so well on these meds, I feel fine. Is it really that big of a deal if I miss a pill every now and then?
It may not feel like a big deal. For your treatment to keep working as well as it has, though, it's important that you take your medication every day. Your labs are improving, but avoiding missed doses can help them improve even more. Taking the medication daily is how you can reach and maintain an undetectable viral load and increase your CD4 count. This will first and foremost keep you healthy. When you skip doses, the virus can become resistant to the medication, meaning the medication will stop fighting HIV and this will cause your health to decline. Plus, taking your meds every day and maintaining viral suppression will help to prevent transmitting the virus to others. Let's see if we can't figure something out.
Step 3 is to discuss the treatment plan and address any questions the patient may have.
So, you know it's important to take your medication daily to stay healthy. Let's discuss your medication treatment plan to make sure we're on the same page. You mentioned that you take your meds with dinner. What I'm hearing is that on days when you have to work evenings, you don't always remember to take your meds. Is that correct?
Sometimes, yes.
Step 4 is to ask specific questions about the patient's adherence and identify barriers.
Describe what happens when you work in the evening. When do you take your meds on those days?
When I don't work a day shift, I'm usually spending the day running errands or going to doctor appointments. Then around 5 p.m., I'll start to fix some dinner or grab takeout, then watch the news while I eat, and that's when I usually take my pill. I have my medicine in a caddy on the table next to the salt and pepper, so I see it when I'm eating.
That's great. It sounds like you have a plan that's been working for you when you eat dinner at home. You reach for the pepper and boom, you remember your meds. It also sounds like you might need a plan for the times that you have to work evenings. What time does your evening shift usually start?
At 7. If I haven't eaten dinner by then, I'll grab takeout on the way to work.
Step 5 is to problem solve barriers, identify strategies, and set a behavioral goal to improve adherence.
So, on the days when you eat before you go to work, you're able to remember to take your pills because they're right there on the table where you can see them. On those days when you eat dinner on the way to work, how do you remember to take your pills?
Well, sometimes I don't. Like I said, sometimes I just forget. Like if I'm in a rush to get to work or just not eating dinner at home.
Okay, I think I have a good picture of your evenings. What do your mornings typically look like?
Mornings are kind of the same no matter what. Since I'm so used to getting up at the same time each day, even when I work evenings, I still wake up early. Sometimes before my alarm even goes off. Just a habit, I guess.
Routines can be difficult to change. What can make it easier to remember to take your daily medication is to make it part of something else you do every day. Is there something you do each day consistently around the same time, whether you go to work in the evening or not?
Well, since I'm usually up in the mornings, no matter what, maybe I could take my pill then instead? Actually, yeah. I could take my pill in the morning with my cereal or something.
That's a great idea. Would you be willing to give that a try? Remember, the fewer missed doses, the healthier you will be in the long term.
I understand. I really need to take my pill every day. I think I can get there.
Sure you can. You're almost there already. I believe you can reach complete adherence and take every dose.
Step 6 is to create a tailored medication schedule.
I'm going to make a note in your chart that you are going to start taking your meds in the morning instead of in the evening.
Okay.
Now, new routines can be hard to remember, and this one is really important. So I'm going to type it up on a medication schedule and print it out for you. This is to remind you of your new medication schedule. You can put it somewhere where you'll see it every day as a reminder.
I'll take a picture and keep it in my phone.
Okay, good. If reminders on your phone work for you, you may want to try a scheduling app that can send you a reminder each day to take your pill and help you track each day that you've taken it. You might not look at the medication schedule every day on your phone, but may be more likely to see a daily notification message from an app.
Yeah, I've heard about some of those. I'll check one out.
Finally, step 7 is to motivate the patient to commit to an adherence goal.
People use all kinds of tricks to help them remember to take their medication. Let's see how the app reminder works for you the next time we meet, and we'll go from there.
Okay.
Great. Okay. I have one more request. Can you check in with your case manager in a week to let her know how your new schedule is working out?
I can do that.
Okay, great. Do you want to schedule that appointment now, or should the clinic call you? Which do you prefer?
I'll call her.
Okay, I'll let them know to expect your call. Great. So let's quickly recap what we talked about. It is important to take your meds every day. And you've been really good about taking your daily pill, but missed a few because of the changes in your work schedule. You decided to try taking your pills in the morning with your breakfast, since you eat breakfast at the same time every day, no matter what shift you work. This way, you should be able to take your medication daily. What else did you say you would do?
I'm keeping the new pill schedule on my phone where I can see it if I need to. I'm also going to download an app that will remind me every day to take my meds in the morning, and calling my case manager in a week.
Yes, you got it. You are in a great place with your health, Kevin. Let's keep it that way. Let's plan your next visit in 3 months. In the meantime, be sure to let us know if you have any issue with the medication, like side effects or problems with refills, okay?
Will do.
Perfect. You registered earlier for our telemedicine program, so our next visit will be virtual. The telehealth tech will be in shortly to finish counseling you on that process.
Sounds good.
Okay? I'll see you in 3 months.